Then we'll discuss about peripheral smear of beta thalassemia. So, in the peripheral smear of beta thalassemia, when there is poikilocytosis, that means change in the shape, change in the shape. That means there is a shape difference. And second thing is anisocytosis. That means there is difference in the size also. And you can see the RBCs in the shape of many shapes, right? And this you can see. This is called basophilic stippling. You can see nucleated RBCs. Target cells are like this. And important thing is oval, jolly bodies. So there are some important points which you have to remember. First is poikilocytosis, second is anisocytosis, and third is oval, jolly bodies. So this type of multiple target cells, you can see target cells in case of sickle cell anemia, in case of megaloblastic anemia, in case of thalassemia. And in case of thalassemia, you can see multiple target cells, right? Just remember this. You can see multiple target cells in case of beta thalassemia. Now, we'll discuss here one more thing, which is microcytic hypochromic anemia. Just remember this, you'll get direct question. Microcytic hypochromic anemia. In case of microcytic hypochromic anemia, you can see there is beta thalassemia minor, right? That means there is red cell distribution width, which is 11.5 to 14.5, which is normal. But second thing, you can see iron deficiency anemia, right? In case is due to iron deficiency anemia, there is increase in red cell distribution width, right? So you can differentiate both of them. Like in case of beta thalassemia, if microcytic hypochromic anemia is there, then red cell width is normal. And in case of iron deficiency anemia, if this is due to iron deficiency anemia, that there is increase in red cell distribution width. This is very important criteria for the diagnosis, right? Now there is one important index which is called Mentzel index. In this case, mean corpuscular volume and RBC count is in ratio. This is called Menzel index. So in case of if there is one case, 9-year-old boy having mean corpuscular volume is 60 and has RBC count is 5. That means this index is around 12. So in case of thalassemia, it is more than 13. And less than 13, sorry. In case of thalassemia, it is less than 13. And in case of iron deficiency anemia, it is more than or equal to 13. Right? So you can differentiate according to this also. If this Menzel index is less than 13, then it is thalassemia. And in case of iron deficiency anemia, then it is more than or equal to 13. Right? Then come to your screening of thalassemia. This is one thing which you have to remember, NESTROF. Now, what is this? This is naked eye, right? Single tube, right? RBC, osmotic fragility. This is the test which you have to remember. Nestroff, naked eye, single tube, RBC, osmotic fragility. Again, you have to remember this. Now, what we will do in this case, let's make it here. Now, what you will do in this case, this is 0.3%. Now, what you will have to do in this case, 0.3% normal saline you have to take. Then place a paper, and over the paper, you have to place tubes. Right? You will see when you are placing normal saline in it, in one case, there is complete hemolysis. And in one case, you will see incomplete hemolysis. So complete hemolysis means RBCs are normal. But in case of thalassemia, you will see incomplete hemolysis in case of thalassemia, right? So you can see the black lines through the tube. So this is the test.